Good afternoon, ladies and gentlemen. I'm Steve Rumbelow. I'd like to welcome you all to the annual general meeting for Mersey and West Lancashire Teaching Hospitals NHS Trust. Just so people are aware, the meeting is being filmed and it will be available online following the close of proceedings today. A little bit of housekeeping. We're not expecting a fire alarm, so if a fire alarm does sound, please make your way to the nearest exits. You can see them marked. Mobile phones, please ensure they're either turned off or on silent so that we don't interrupt proceedings this afternoon. I'll be joined on stage in a moment by our Chief Executive, Rob Cooper, and we've also got members of the Trust Board and the executive team with us as well. Rob will be joining me on stage because he needs to do the hard work as usual. Last year's AGM took place on the 27th of September 2024. It's still available to watch on the Trust website, and the minutes from that meeting have been distributed to all attendees today. So the first part of our business today is to actually get those minutes approved. So can we approve those minutes? Thank you, Anne-Marie. Thank you, Leslie. Okay, minutes of last meeting are approved. Rob's going to run through a review of 2024-25, which is the main purpose of this meeting, but it's also important to take a forward view. So Rob's also going to talk about the achievements during the year, what our wonderful staff have been able to achieve, but also to look forward to see what might be coming at us in future. We'll then take questions from the audience. We've had one written question, but we'll come back to that later. But for the moment, that's all I have to say, and Rob's going to join me on stage and take us through.
All right, find the glasses. It's always helpful. Thanks, Steve. Good afternoon, everyone. Great to see you all. So today I'm going to share a view of the past 12 months and look ahead to the coming year. And we're going to begin, as always, with a review of our activity. So just picking up on some of the data that you can see in front of you there, starting with that drop in births, so minus 6.5% in year. So that's reflective of the national position, with the birth rate at its lowest in England since 1977. GP referrals, as we can see there, continue to grow year on year, and they were up 2% last year across most specialties. Some people in the room might recognise this, but we've certainly seen the biggest rise in dermatology, ENT and gastroenterology across all those specialties. Referrals for urgent cancer patients have increased slightly at 2% as well. And what we're seeing here is a levelling out post-COVID. I think people will remember previous years where we've seen some really significant rises in some of these figures, and particularly for the cancer 2-week wait. And that was as a result of GPs trying to seek a route around the delays, but conversions to cancer haven't seen the same increase. As you'd expect, first outpatient attendances are up in response to that, so you can see an increase there of 5.2%. And that knock-on effect continues with a large increase in elective and day case activity as well, which we've been able to achieve due to the extra capacity creating 2 new theatres at Wiston last August, and a real focus on maximising efficiency across all theatres as a whole. So it's good to see that some of the system working to provide alternatives to urgent and emergency care has had some degree of impact, although that doesn't necessarily feel that way in terms of the departments. But however, emergency admissions on the back of that have increased again due to the acuity of those attending, which again reflects what we're feeling within the emergency departments and through urgent and emergency care. And of course, people feeling that every day. So bed occupancy, another thing is resulting on the back of that activity that we've talked about, and our average bed occupancy figures last year were coincidentally 106% at both Wiston and Southport hospitals, which equates to needing an additional 138 beds on average across the trust. One of the key factors contributing to this is the ongoing situation that we face with patient discharge. So specifically, a number of patients remain in our hospitals even after they're medically fit to leave. Although we continue to work closely with our system partners, this does remain one of our greatest challenges as an organisation. And I do want to acknowledge the significant impact this situation has on our hospitals and our staff, and sincerely thank everyone for their continued dedication and hard work. We're managing very high levels of occupancy and activity. The overall quality of service and patient experience can be affected. Whilst we're committed to always maintaining the highest standards, these conditions inevitably present challenges, and that is reflected in our quality standards, which I'll move on to next. So, starting with HSMR, or Hospital Standardised Mortality Ratio, it's a healthcare quality indicator that compares a hospital's observed number of deaths, so actual deaths, to the number of deaths expected for its patient case mix, providing a warning sign if it's higher or lower than predicted. So an HSMR of 100 is the benchmark, with scores above 100 indicating more deaths than expected and scores below 100 indicating fewer. So 90.5, good place to be, but also an improvement on last year. Number of never events, sadly, at 5. These events resulted in no serious harm, but it isn't acceptable to have never events. And as you'd expect, each event was fully investigated and lessons were learned and new processes introduced. So let's move us on to infection control. So disappointingly, there were 6 cases of MRSA bacteremia again last year. 1 was deemed unavoidable. The rest were lapses in care, 4 relating to cannula care, and 1 linked to a urinary catheter. Again, an extensive programme of staff education and training is underway. We continue to monitor this situation and the effectiveness of our actions closely. You'll see there we had a total of 114 C. difficile cases across the trust, which is better than the situation in other hospitals across the patch and is just 1 over the trajectory. So moving on to pressure ulcers, a slightly increased number of 57 compared to 42 the previous year. And on to falls, we've seen a slight improvement in this area from 82 to 75. So falls and pressure ulcers, learning reviews have been completed in all areas of high incidence, and action plans are in place just to ensure that we are learning from anything that we find as a result of those investigations. So finally in this section, just to note the complaints and the increase throughout the year. Primarily that's due to extended waiting times, which have led to frustration and concern among some patients, and that also was noted in our figures, bed occupancy and otherwise that I've already spoken about. But to address this, we're working hard to reduce waiting times by increasing capacity in our busiest services, improving appointment systems, expanding digital and virtual offerings, and investing in faster diagnosis processes. So these efforts are aiming to accelerate the delivery of care and improve the overall patient experience. So moving us on to performance. Seen here in comparison with national targets and national performance across the country, it is clear that many trusts are falling short of meeting these targets, and you can see that right across the board there. At MWL, we achieved the 4-hour ED target for our footprint, and you can also see we bettered the national performance. We ended the year not where we should be for the cancer faster diagnosis standard, which is an area of real focus for us, which we'll pick up later on. For 18 weeks wait and 62-day, the trust didn't achieve the target but bettered the national performance, which is why they are amber on the screen in front. And just to note as well, for 62-day performance, we were in the top 20% in the country in this particular category. So we continue to see a high number of patients awaiting longer than 52 weeks, another focus nationally in terms of long waiters, largely due to the ongoing impact of the pandemic backlog and other challenges with elective recovery. There's a lot of work ongoing to address this, and we're in a better position compared to last year's figure, which stood at 2,518, and we're confident that this number will continue to decline going forward. A real positive in our performance actually here is the increase in the number of patients receiving a diagnosis within 6 weeks. As you can see, we finished the year well above the national average and came very close to achieving the target. And again, just to look back slightly here to note the progress in this particular metric. In 2023, our performance was just under 88%. So it is good to see that moving in the right direction at 93.1%. So in the long run, as people will understand, That has a positive impact on other metrics and gets our patients to treatment in a much more timely way. So, on to finance. We finished the year with a 14.5 million deficit. It's actually 14.7 million deficit, in line with our plan, aside from a theoretical adjustment agreed with NHS England that didn't affect our underlying cash position. We achieved a 4.9% efficiency saving by improving the use of our services and resources, and we focused on getting the best value for every pound spent, and where that wasn't the case, we set out to change it. So, for example, we renegotiated several contracts with suppliers which improved value without affecting product quality. We saved 144k by purchasing beds instead of hiring them, 58k by switching to recycled paper, 22k by using blood bikes instead of taxis to transport maternity and neonatal samples from the community to our pathology labs, 25k by sourcing a local supplier of a nutritional supplement, saving on delivery costs and reducing our carbon footprint. So it is significant progress in delivering both value and sustainability for the organisation and, of course, for our patients. So we invested just over 45 million this year, which included over 6 million spent on equipment, 11 million on digital solutions, including a new laboratory information system, and more than 25 million on improving and developing our sites. And here's just a few of the capital projects that we've completed. So at Wiston, I mentioned it before, we opened 2 new operating theatres and refurbished Theatre 5, installing a state-of-the-art ultra-clean ventilation system. At Southport Hospital, we refurbished the emergency department canopy and improved patient and staff facilities in the regional spinal unit. At St Helens Hospital, we created 184 more car parking spaces and built a new road to improve access for staff. And at Ormskirk Hospital, we installed a new dispensing robot to increase efficiencies in the pharmacy department and opened a brand new physiotherapy unit, which is fantastic. I visited it myself the other day. Great to see such positive developments across our estate for the benefit of patients and staff. So, place assessment. This was recognised in the place-led assessment of the care environment when the Trust was ranked top in the North West and 4th in the country. Great results that highlight our commitment to delivering the best standards for our patients. And on screen, you'll see some of the team who made this happen, looking really proud, and rightly so. And the Place Award wasn't the only highlight of the year. So, I'd like to congratulate all the teams and individuals who've been recognised this year, including Helen Day, Sister Ormskirk Hospital, who was named Paediatric Nurse of the Year at the Diabetes Nursing Award. The Wiston and St Helens Hospital's CT team won Team of the Year in the North West Region Radiography Awards, and Alan Sutton won Lifetime Achievement at the My Porter Awards. Caroline Atwood and Sandra Ryan were recognised in the Queen's Nurse Awards. Anome Oyedokun was named Preceptor of the Year at the Nursing Times Workforce Awards, and Gina Rogers was also recognised for her incredible career with a Lifetime Achievement Award at the NHS North West Healthcare Science Awards. So on behalf of the Trust Board, I'd like to say thank you to them and share my thanks for their continued hard work, commitment and resilience. So that completes my review of year 24-25. So just moving on to the year ahead, which began with a series of announcements about the NHS, the way it's managed and structured, as well as its long-term vision. In July, the government published the Fit for Future 10-year health plan, which sets out how the NHS will transform to meet the challenges ahead. A major focus for this plan is on what they are calling the 3 shifts, so shifting care away from hospitals and into local communities, from analogue to digital and from treatment to prevention. The vision is to build a stronger, more joined-up NHS, focused on keeping people well, not just treating them when they're unwell. So going forward, local leaders will have more control to shape services that truly meet the needs of their communities, making care more personal and effective. As part of the NHS's long-term vision, there are several important short-term priorities that we need to focus on. These national priorities guide the objectives we've set for our Trust in 25-26, and some of the key focus areas as follows. So our key priorities, and you won't be surprised to see some of the things in here on the back of last year. Reduce the time patients wait for elective care. So the NHS aims to achieve 92% of patients referred to receiving their treatment within 18 weeks by March 2029. It is an ambitious target. We've achieved it before, but the first steps towards that goal is to achieve 65% of patients receiving elective treatment within this time frame by March 2026. And at MWL, we're currently very close to achieving that and hope to surpass that target by 5%. The second one there, improve A&E waiting times and ambulance response times. So our plans focus on reducing delays in all our emergency departments, with the national target set at 78% of patients to be admitted, discharged or transferred within 4 hours by March 2026. Additionally, we are working hard to help improve ambulance response times and minimise long stays in accident and emergency. Next one there is to increase the number of cancers diagnosed and treated at an early stage. Trust aims to meet the national 62-day urgent referral to first treatment target and the 28-day faster diagnosis standard by March 2026. And that includes providing quicker diagnosis for patients referred for urgent cancer checks. So use technology to improve healthcare services. In line with the ongoing digital transformation of the NHS, we're embracing new ways to make patient care more efficient, accessible and personalised. New technology has a vital role to play and is already helping us to expand our virtual wards, develop new diagnostic systems like teledermatology and introduce a single electronic patient record across MWL. Just this morning, the government announced their intention to forge ahead with what they're calling an AI, artificial intelligence-powered healthcare system. So I'm pleased to say that we're already looking at this and have established an AI working group to explore how this technology can be used to improve patient and staff experience across the trust. So we're also looking to reduce agency spend. And at MWL, we continue to build a strong, skilled workforce by supporting staff wellbeing and career growth whilst reducing costly agency spending through better recruitment and retention. This ensures high quality, sustainable care and is a more efficient use of resources. And talking of efficiency, of course, we need to achieve the financial goals. Like all trusts across the country, MWL must make the best possible use of all available funds by reducing waste and controlling costs without compromising the quality of patient care. So our aim is to deliver excellent healthcare services in the most cost-effective way. And finally, at MWL, we also have a priority to stabilise fragile services. So the main reason the Trust was formed just 2 years ago was to stabilise a number of fragile services at Southport and Ormskirk hospitals. And I'm pleased to say that we've already improved the delivery of ophthalmology, rheumatology and haematology, and will soon be opening new state-of-the-art endoscopy suites at both Southport and Ormskirk hospital sites. In addition, the Trust continues to work in partnership with the Integrated Care Boards of Lancashire and South Cumbria and Cheshire and Merseyside on the Shaping Care Together programme. The first phase, focusing on the future location of urgent and emergency care services, is currently a matter of public consultation. This ends next week on the 3rd of October, and a decision is expected to be made early next year. So, as you'd expect, all of these priorities and more are reflected in the Trust's annual objectives, which help us to achieve our vision of 5-star care for every patient, every time. Thank you.
Thank you, Rob. Thanks very much indeed. Very comprehensive review of the past year and an insightful look to the future. It's undoubtedly been a year of very significant change, and there's much, much more to come, and therefore lots of work ahead for us all. Rob mentioned the NHS 10-year plan. I just wanted to acknowledge that the plan itself is a very, very good plan. The ambition around the 3 shifts that Rob mentioned is right, and it's to be welcomed. They focus on creating a healthcare model centred on prevention, one that considers the whole person, their identity and how they live. This approach isn't new to us at MWL. We've had strong plans based on those same principles over a number of years now, and aiming to move us away from the sort of hospital by default mentality that sometimes we see around the system. Because of that, we are very, very well placed as an organisation to adapt to the changes, and I'm confident we'll do that very successfully and have a major contribution to how these changes are taken forward. It's time for questions now. As I said earlier, we do have one written question from Mr. Barry French, who's also here with us today. Hi, Barry. Thank you for your question. It's coming on screen now, any second, I think. Yep, it's on screen now. Mr. French asked, as Ormskirk Hospital is under 2 ICBs, can you tell me when this will change and come under the umbrella of just one, as it can cause confusion in asking freedom of information questions? We also have no direct access to PALS, as I have to go to Sefton to ask a question, I have to go to South Cumbria and Lancashire for questions on primary care, and Merseyside and West Lancashire on anything else. Here in West Lancashire, we must be the only people under 2 ICBs in all of England. We've prepared a response to that, and it is complex. Mr. French, you're right to identify that. This is the response. Following the announcements that Rob talked about earlier, the role of NHS England and the Department of Health and Social Care will start to change. The arrangement for integrated care boards across the country has been reviewed at a national level. Based on the size of the populations covered by both Cheshire and Merseyside and Lancashire and South Cumbria ICBs, there have been no proposals for the Secretary of State to consider to change the current ICB boundaries or to put in place joint arrangements, which are being put in place in some other areas, on management. Looking ahead, the role of ICBs is set to evolve. As outlined in the NHS long-term plan, ICBs will become strategic commissioners responsible for commissioning health services for their respective populations. Consequently, from an MWL perspective, we'll provide services to the populations of both Cheshire and Merseyside ICB and Lancashire and South Cumbria ICB. And we also expect additionally to be potentially commissioned to deliver different services to those ICB populations. The bottom line really is the Trust cannot change the ICBs that it works with. This is determined by the populations they serve and by the national framework for it. Wiston, St Helens and Southport hospitals fall within the boundary of Cheshire and Merseyside ICB, whilst, as you know, Mr. French, Ormskirk sits within the Lancashire and South Cumbria ICB boundary. So that's the response to that, and I know we've had a conversation before and we'll be talking about some other things separately. Are there any other questions or comments that anyone in the audience would like to make about today's proceedings? No? Okay. If you want to ask questions that you think about afterwards, you can email them in, so you can email them to me on chairman@merseyside-westlancs.nhs.uk. I'd also like to formally note that all our statutory documents, the annual report, annual accounts, quality account, will also be available online after the meeting. In relation to the annual accounts, there's a slight complication. Grant Thornton are waiting for final confirmation from the National Audit Office before they can issue the Trust's financial audit certificate. I want to stress that is not because there are any concerns about the opinion that is going to be expressed on the accounts. It's the fact that the accountants are being, the auditors are being audited themselves, and so until that audit's complete, they can't issue the audit, any of their audits. These documents will be issued alongside the other documents when they are available. Okay, just to remind people that we have been filmed today, so if you really want to spend time looking back at the meeting that you've already attended, you can do so at your leisure later. But finally, I just want to express my sincere gratitude to all the staff for their remarkable commitment, absolute mega hard work, and also a good dose of good humour from what I've witnessed going around some of our sites to get through the really difficult year that we've had and to prepare us for the year ahead, which will still have many, many difficulties. But the bottom line is you're all driven by making sure that patients get 5-star patient experience, and that's what really matters. So, thank you for your time, and at that, I'll close the meeting. Thank you.